Thanks, Jason. Well, October is National Breast Cancer Awareness Month, and early detection is key to successfully treating the disease. And since the start of the pandemic, many women have been putting off getting their annual mammograms, and others have never had one and may have questions about them. Well, our sponsor, Beaumont Health, has answers. We are joined by Dr. Lisa Awan, a radiologist with Beaumont. Thank you so much for being with us.
Oh, thank you for having me.
First, let's tell everyone why mammograms are important.
Mammograms are important because they're our best tool at detecting breast cancer in its earliest and most treatable stages.
Okay, now there's been some questions about these. I've heard different numbers. When should women start getting mammograms?
So the best recommendations to save the most amount of lives is starting annual screening mammogram at age 40. Or if you had a first-degree relative, such as a mom or sister, 10 years before their diagnosis.
Got it, got it. So should women get mammograms every year or?
Yes, definitely we recommend every year, and that is because our most important tool is being able to compare to the year before and the year before. That's what allows us to detect those very subtle changes that might represent a very early breast cancer that's brewing. That's why we're able to find them at such a small size compared to women who are waiting more than 1 year.
Okay, so now let's go back to family history and genetics again. How important is this to consider when getting a mammogram?
So family history is very important. If you have a few close family relatives, normally your risk would be higher than the normal woman. However, I do want to emphasize that 90% of breast cancers are random and are not related to family history. So every woman should be getting annual screening mammograms, but if you do have a family history, your risk will be a little bit higher, and you should check with your doctor to see just how high that risk is, because it might mean a few different things that we might need to do.
Okay, now are there different types of mammograms?
Yeah, so the normal mammogram is also known as a 2D mammogram. That's kind of been the normal mammogram that's been around for a while. More recent technology is known as a 3D mammogram, and that is a much better mammogram that allows us to look through dense breast tissue and find cancers earlier and more easily.
All right, wow, this is great information. Dr. Lisa, thank you so much for joining us this morning.
Of course, anytime.
And if you have questions about your risk for breast cancer, Beaumont Health has a free online risk assessment. Visit the website beaumont.org/mammo. Again, that website is beaumont.org/mammo.